Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine that we put together here at the Virginia Institute for Public Policy. You can find us online at tertiumquids.org and find out more about our Tuesday morning group coalition, our white papers on various legislative agendas coming through the House. And I know there's a lot of frustration, but believe me, there are things afoot and there are things you can do. And we are the place to find that sort of stuff. You can also find previous editions of Freedom and Prosperity Radio through our YouTube channel. Just go to YouTube and then search Freedom and Prosperity Radio. Our first guest is Senior Policy Analyst with the Reason Foundation, one of our favorite groups. Marc Joffe is on with us. Just penned a great article hearkening back to my childhood when the TV ads would say, "Let's get Mikey." Even Mikey won't eat it. Mikey doesn't like anything, and it's a story about government health care versus private health care. The article is called "Even California Democrats Prefer the Private Health Care System Over Medicare for All." Marc, welcome back to the program. How are you doing, sir?
Well, great. Thanks for having me, Joe.
You remember those old ads? "Let's get Mikey. He won't eat it. He hates everything," right?
I do, and yes, I'm now admitting my age, but I do remember those ads quite well.
So if even California Democrats, who I guess, the implication is these are super Democrats, because, if it's California, they've got to be nutty. What is happening in California that's made them realize this? Is this just the natural state of affairs? You try Medicare for all until you realize how bad it is, and then you give up on it, hopefully, keeping my fingers crossed? What's happening?
Well, I do live out here amidst the super Democrats, so I have I have some unique perspectives into their thinking. Actually, a few years ago, we had a single-payer bill for the state, and it went through the state Senate, and then fortunately, the head of the state assembly, a Democrat, just shelved it. It was going to cost an estimated $400 billion, which was double the state budget.
Oh my gosh.
So, and no one really knew where the money for this was going to come from. So, fortunately, you do have some sane Democrats who realized that it was necessary to tap the brakes on that thing. And I think that there's been skepticism about single payer ever since.
Is it just a matter of finding that tipping point where we've talked about Elizabeth Warren's plans on this program before as well, where the numbers just become so obviously unpencilable that no thinking person could even come up with a bit of rhetoric to cover it up?
I think that's the case. I mean, you do clearly have two strands of thought within the Democratic Party. You have people who are really essentially socialists in the old Soviet style of the word, who really just don't care what things cost and think that so-called rich people have unlimited amounts of money that can be taken and redeployed for whatever purpose it is that they want. And so they really don't look at the economics. And then I think you have a group of people within the Democratic Party who are more business-oriented and are more economically literate, and they realize that government can extract a lot of money out of a productive economy and use it for whatever crony purposes they would like to use it for, but there's a limit to it. And if it gets to the point where the government completely disrupts and replaces the existence of the market economy, the piggy bank won't be there to raid any longer. There won't be. I think I'm looking for some analogy with geese, but
well,
I think you get the idea that there won't be the spoils that can be used for the political system. So they have to maintain, some level of a free market economy, and I think that kind of thinking is prevailing here.
Let me gameplay this out, because what fascinates me is that there is still the mindset among many of the statists, and I'll say it that way because I don't think they're confined to one political party. As I find conservatives more frequently in the Republican Party, I find statists more frequently in the Democratic Party, but it's not inoculated against both. that there's just a way that hasn't been found yet to do it right. That we just haven't found the magic formula to make this collectivist mindset work. We've got modern examples. Venezuela, as resource rich as any place in the Western Hemisphere outside of the United States, and they collapse with first mandatory wage hikes and then price controls on top of it. Their economy just crumbles at breakneck pace, yet somehow it's like, oh, well, they just did it wrong down there. We'll do it better up here. Is that arrogance? Is there a magic formula, Mark, in your studies?
Well, I think you always will hope that government will do things properly, but there are a lot of reasons why government often fails and does things improperly. Here in California, we have the ongoing tragedy of the high-speed rail system. So in 2008, voters voted to build a $33 billion high-speed rail line from San Francisco to Los Angeles. Now that's estimated to cost something in the excess of $98 billion, and there's no end in sight to the completion, and in fact, there's just no funding mechanism for it. So,
and by the way, it doesn't go to San Francisco or Los Angeles either. It goes to, I think it goes from Stockton to someplace east of San Francisco.
Somewhere north of Bakersfield.
Yeah.
Madeira to somewhere north of Bakersfield, yes. And that also is slated for completion in 2028, if then. So, what and think about we're speaking the day after the disaster of the Iowa caucus, where the Democratic Party couldn't even release a vote count in a reasonable amount of time, and it harkens back to the disaster that we had with Obamacare when they turned on the website. Voila, it didn't work. Nobody could sign up for their coverage. So why do these things happen? And I think there's two things to consider. One is that government is normally not competitive, so they're not really worried about other people, coming up and doing a better job. And related to that, there's no profit motive, so it's sort of hard to measure the results of what government is doing in a way that in a way that everyone can sort of see that they're actually meeting the needs of people who have the ability and willingness to pay for whatever services they're providing. So they're just not getting the market signals that they need, and so as a result, bureaucracy, the kind of talents that you need to succeed in a bureaucracy, like backbiting and so forth, that's sort of what gets you to the top. And just basic skills in terms of being a good programmer or managing people well. These kinds of things tend to get lost in the slush. So I think that's one reason why government enterprises, especially large-scale ones, tend to do poorly. But of course, there are always exceptions. I mean, the space program, for example, was very successful. It cost a lot, but we still got a man to the moon in the allotted amount of time. So it's not impossible for government to do things well, but it's just usually pretty unlikely.
Mark, you said something that I really want to get to. We're visiting with Marc Joffe, Senior Policy Analyst with the Reason Foundation. Great article. We'll link it up at tertiumquids.org. Even California Democrats prefer the private health care system over Medicare for all. But you mentioned something just there about the profit motive. And I want to, on the micro, go into the vilification of the word profit. But you don't have to be John Galt's descendants to understand that the profit motive is what makes, or is the root of, American exceptionalism. Is that whether I started the company or I've chosen to work for the company, my choice is what makes me work so hard, and it's what made the American workforce the envy of the world very quickly, because that free association, my ability to say, well, I really like working for him, so I'm going to work harder, or I've invented something and I'm getting to benefit from it, so I'm going to work harder at it. That formula really was like a wildfire economically.
Absolutely. And yes, socialists are constantly vilifying the profit motive. And, I think there are two really important points about that. First of all, profits aren't the only type of return that exists. I mean, most of the health sector is not for profit. Most hospitals, don't make a profit, but they actually do have excess returns in the sense that the income that they receive from patients, insurance companies, and the government exceeds their cost of operating. And so that gets sort of stuck in their balance sheet somewhere, number one. And number two, it's often used to raise the salaries of healthcare professionals. A few years ago, I did a survey of hospitals in Virginia, and I found that quite a number of hospital executives back in 2013 received over $1 million of annual compensation. So that's really not that conceptually different from a profit. Mm-hmm. And then, second, and I think more to your point, the idea that there's a profit means that your energies are going to be focused towards providing what consumers want. And that's really the huge danger of moving towards a single-payer health system, because now no one's going to have an incentive to provide excellent medical care. I mean, we're seeing even with all of the government interventions, even out here in California, we've had the successful IPO recently of One Medical, a concierge medical provider that my wife just loves. Anytime she's got a medical complaint, she goes in and gets great care without waiting for a long time. For people on more modest income, you have the clinics in places like Walmart and Walgreens and CVS.
And First Med.
These are often staffed by nurse practitioners and other mid-level professionals. These are the kind of things that, faster, better, cheaper, getting you, the care that you need at the lowest possible cost. And all of that gets lost when you replace a competitive system, and one that's in at least part motivated by the profit motive, by single omnipotent government provision of a service.
Mark, I think we may have talked about this back in the salad days of the beginnings of Obamacare and the debate. But if we haven't, please, But one of the early arguments for Obamacare was that the old country doctor had gone away, and this was going to force that back into existence. But really, what had happened was the small town doctor had been regulated out of existence by insurance costs and regulatory burden that had driven them to the point where they had to join these medical co-ops just to be able to get the bills within a relevant a place to be able to pay them. And nobody fixed that. Nobody went in and tried to fix that. They said, well, we'll layer something else on top of that that'll force everyone back into the small towns.
Yeah, and I mean, a lot of primary care doctors rely very heavily on Medicare and Medicaid reimbursements. And Medicare and Medicaid, especially Medicaid, pays a lot lower than private health insurance. So as more people get into government systems, the doctor has a huge bureaucratic overhang of trying to just get these reimbursements, and then second, they're not as high as they would be if more people were under private insurance. So it does become difficult for primary care practitioners, especially in rural areas.
Back in the 2000s, even before Barack Obama was president, one of the arguments for Medicare was that it was more efficient than the HMO. Which I said, well, okay, I'm not a big fan of HMOs either, but the question always was, if you scaled up Medicare, would that efficiency scale up with it? And I think that's one of the things we've noticed is that as you scale up Medicare, it becomes just like any other bureaucratic medical system. It becomes less and less efficient, and all of that, well, look at how efficient Medicare runs when it was a small, portion of the government, has gone away.
Yeah. I mean, I guess I'd say a couple of things. First of all, Social Security is a fairly efficient government system because it's just so simple. I mean, you calculate what the person is owed, and then every month you send out a check. And I think the government does a pretty good job of reliably sending out Social Security checks that are accurate. I'm sure there are exceptions, but 99 out of 100 is probably a fair estimate. When you get to Medicaid, there are so many complicated billing codes, and then there's the ability of hospitals, especially the really well-run ones, to figure out how to game that, to sort of upcode things so that something that seems relatively simple turns out to be a relatively complex procedure that gets a higher reimbursement. So those kinds of things get really hard to control. I did want to talk about HMOs a little
Sure.
because that is a distinct thing about California, and I guess I have a little, I have a little bit softer spot in my heart for HMOs perhaps than you do. We have Kaiser Permanente out here, and they take about a quarter of the population into their system. And the advantage of an HMO is that you basically are paying one cost for all the treatment that you're going to get in a given year. And if you have enough people in the system, the people who need more treatment than expected are offset by the people who need less treatment than expected. And the HMO has an incentive, which a lot of patients don't like, but I think ultimately, for the purposes of holding down healthcare costs, is a good one, which is to say, well, wait a second, you maybe you don't need surgery for that hangnail, or maybe take 2 aspirin and call me in the morning, as opposed to like what happened with me when I had some heart palpitations. Instead of them saying, well, you probably just had you just probably had a minor muscle malfunction, which turned out to be what it was. I ended up being admitted to the hospital for 24 hours and running up $11,000 of bills. So I think it's good for medical providers to have an incentive, either through the market or through some kind of managed care, to not over-provide health care. And so I personally see some value in HMOs.
And the premise, and I remember when they were getting started, and certainly they were accurately depicting, the process of getting your bills reimbursed from a traditional insurance provider, and do approve this and get this letter, and if you missed something, sorry, thank you for playing. So I get that. I guess maybe the problem is the HMO marketplaces have become less and less competitive, where in Virginia we have really just one, and so they control all the doctors and all the consumers, and can sort of dictate terms rather than saying, well, gosh, if we're not meeting the needs of the consumer, they might quit us and go to another HMO.
Yeah. I'd like to learn more about the situation in Virginia. I mean, here in California, Kaiser, again, 25% share of the whole medical, medical services market, would seem to indicate some monopoly power. But a lot of people are in preferred provider organizations, and they don't have any exposure to Kaiser whatsoever. So I think there are different kinds of HMOs. There are ones where the HMO itself is providing all of the services in a closed system, and then the other is really an insurance company provided HMO, which is just sort of cobbling together a network and then limiting you to the practitioners within that network that you can use. And maybe that might have more problems with it than the other model.
Yeah, go figure. A marketplace working, Mark, right?
Or not working because it's so distorted by the government.
Yeah, well, Marc Joffe is Senior Policy Analyst with the Reason Foundation. Mark, thank you so much for everything you do. And like so much of America, California is a great place. It's beautiful and it's stunning. And I guess that what did Clinton say in his inaugural? There's nothing wrong in California that can't be fixed with what's right in California. And the same is true everywhere in the United States. And we appreciate everything you do. And thank you for being our guest this week on Freedom and Prosperity Radio.
Thanks for having me, Joe.
Coming up next, Director of Policy for the Tertium Quids organization, Caleb Taylor, on the General Assembly and where we stand as we approach crossover on this week's Freedom and Prosperity Radio.